before we proceed with the business of the day, I'm going to allow our children, the school learners from Louis Water, to come and render some music to us in honor of all of us, including their MEC. So I'm going to suspend the proceedings for now. You may allow them in
Honorable members, we may be seated. Honorable members, thank you for allowing our children to do that in front of all of us. Honorable members, in terms of questions for oral reply, I've been advised that all questions have been responded to. So we don't have questions that we are going to deal with in the House. We are therefore going to move to motions according to Rule 61 to 63. We proceed with the second reading debate on votes of appropriation bill in terms of Rule 170. We proceed to motions. The Secretary shall read motion 1.
The second reading debate on appropriation bill 2 of 2022 to be continued with vote 5.
The vote before the House is vote 5. Health. The Honorable MEC Matthew may address the House. Honorable MEC, please just pause before we can proceed. Honorable members, I only have one apology, and that is that of the Honorable Premier, Mrs. Ndongeni. Proceed, Honorable MEC.
Thank you, Honorable Speaker. Honorable Speaker and Deputy Speaker, Premier in absentia, members of the Executive Council, members of the Legislature, executive mayors and speakers and councillors that are present here today, even on the virtual platform, Director General, HODs, and members of the senior management in government, members of the health governance structures, members of the media, distinguished guests, people of the Free State, ladies and gentlemen. My greetings go to everyone in this August House, those who have joined this sitting through different virtual platforms, and those listening from different radio stations. We have gathered here today just 22 days before the anniversary of the National Freedom Day. We are in the 28th year of our democracy and on a trajectory to end inequalities, unemployment, and poverty. Our world-renowned hero and icon, and the first democratically elected President of South Africa, Nelson Mandela, after the dawn of democracy, said, open quote, after climbing a great hill, one only finds that there are many more hills to climb, close quote. Honorable Speaker, healthcare is a complex adaptive system made up of many moving parts, which are all important in the same time. We believe this is the reality that Nelson Mandela was talking about. The Department of Health is the most complex of the configuration of government departments and impacts on everyone, from conception through the cradle, youth, old age to the grave. We often find ourselves compelled to continue climbing one hill after the other, if not simultaneously. It is the responsibility of leaders to make the world a better place to live in. This was emphasized by Madiba on one of his addresses when he said, open quote, it is in your hands to make the better world for all who live in it, close quote. He, however, acknowledged and anticipated that this ideal will not be realized without commitment, courage, and efforts. Hence, during his address at the London's Trafalgar Square in 2005, he said, open quote, of course, the task will not be easy, but not to do this would be a crime against humanity, close quote. Paraphrasing the above, one would say, it is in our hands to make a better Free State for all who live in it. Her Excellency, the Premier of Free State, Mr. Ndongeni, on her State of Province address, SOPA, has emphasized the narrative of # building the Free State we want. Speaker, The Free State Department of Health during the 2022 MTF period commits to contribute towards the realization of this vision through the tabling of this budget. We believe amid challenges facing the department brings hope and courage to do better with our limited resources, to continue saving the lives of our people and ensure quality and accessible health care services to all. This is the constitutional obligation that we are committed to and that we shall always strive to achieve. The war situation between Ukraine and Russia is directly impacting on the economies of the world. This is evident in the increase in price and fuel, food, and the inevitable latent medical inflation. Our country is at the receiving end due to its distressed economy and the high rate of inequality, unemployment, and poverty that bedevils the socio-economic development. The health sector in general has been hard hit because most of the life-sustaining medicine, consumables, and medical equipment that are utilized in our facilities are not locally produced. Speaker, over the past 2 years, we have been fighting the COVID-19 pandemic. We are fortunate as South Africans to have been able to curb its spread and save more lives under the leadership of President Matamela Cyril Ramaphosa. The sixth administration was at the time tested through the major challenges presented by the COVID-19 pandemic. When everyone thought that Free State would be the epicenter of the virus because of the COVID-19 church outbreak, we quickly contained this threat through our dedicated trace and track efforts that were technologically based. We were the first province in the country to vaccinate 50% of the targeted population. It was not easy, but we managed to overcome and ultimately bring the situation under control. We remain committed to our departmental mandate of saving lives and increasing the life expectancy of our people to 70 years as reflected in the National Development Plan Vision 2030. COVID-19 impact. In September 2021, the President of the Republic and his National Department of Health recognized the Free State for its outstanding efforts in the response against the spread of COVID-19. We are now reaping the rewards of our relentless efforts to achieve excellent results in the fight against COVID-19. This was evident when Free State received recognition as the best performing province in response to COVID-19 under the following three categories: equity among the insured and uninsured, vaccination of high-risk population, and overall vaccine coverage of more than 50% of the eligible population. Speaker, I'm also proud to announce that the Free State Department of Health scooped further awards at the National Batopele Service Excellence Awards held on Thursday, 24th March 2022 at Beechwood Hotel in Ekurhuleni, where our doctor, I think he is around, maybe he can stand so people can see him, Dr. Nicholas P.S. from Universitas, was voted the best doctor in the country, the COVID-19 in the country.
Just a reminder to our guests that they should remain inactive and not participate in the proceedings of the House, whether in terms of uploading or ululating. That is in terms of the proceedings of the House. Thank you very much. Proceed, Honorable Ellison.
Thank you, Honorable Speaker. While Palo Samuel Tsela from Dihlabeng Regional Hospital was voted best healthcare worker in the country, she is a professional nurse, and Ms. Blackie, a cleaner from Tabanchu Clinic, and herself an accolade or runner-up in the category of best general worker in the country. Hashtag building the Free State we want. We are now into the third year of living with a highly dynamic COVID-19 global pandemic. We have lost our loved ones. We have also seen others being hospitalized with severe illness, myself included, while social, economic, and political and every facet of human relations have somehow been impacted. Whilst this is the case, we have also seen new opportunities emerge that require of us to harness and embrace them towards a new dispensation. the impact on staff of the COVID-19. In response of the COVID-19 impact, the department had to recruit several staff to match the demand. A total of 1,927 healthcare workers were appointed on contract from March 2020. These include 2 medical specialists, 29 medical officers, 1,161 nurses of different categories, 51 allied health professionals, 59 pharmacists and pharmacy assistants, 3 biomedical engineers, and 622 other support staff. We are proud to indicate that the reappointment of all these healthcare workers for 1 more year is already underway. This is a significant contribution by health to fight against COVID-19 because we know that it is still there, it's not yet over, but also unemployment in our province. These appointments, especially psychologists and social workers, were made to provide the much-needed psychosocial support to both the public and healthcare workers. About 7,939 officials tested positive for COVID-19, while 151 sadly passed away due to COVID-19 related complications. May their souls rest in peace. There was a significant decline in the utilization of healthcare services, particularly during the higher levels of lockdown and the different waves of primary health. The primary health care headcounts dropped from 5.4 million in 2019-2020 year to 4.8 million in 2020-2021 and further decreased to 4.6 million in 2021-22. Similarly, the outpatient department headcounts dropped drastically from 1 million in 2019-20 to 660,591 in 2020-21 and 701,077 in 2021-22. This had further adverse impact on the health programs. The ward-based outreach teams could not conduct household visits as they focused on COVID-19 screening, which affected the related headcounts and the critical function of early detection of diseases and referrals. On the health programs, on the HIV and AIDS program, HIV counseling and testing services were adversely affected. The patients that were initiated on ARV treatment dropped from 35,058 to 23,691. Fewer patients were diagnosed with HIV positive, therefore reducing the number of HIV positive patients to be initiated on ARV treatment, and currently the Free State is at 91, 81, 92. You know that we should be, the target is 90, 90, 90. So it means we are not doing very well there because we were affected by the COVID-19. At some point, we were at 90, 90, 90. With tuberculosis, the total number of patients diagnosed with TB has declined from 10,266 in 2018 to 9,203 in 2019 to 6,256 in 2020. This significantly increased the number of eligible patients that could not be initiated on treatment and those who defaulted on the treatment. To date, 893 defaulting patients were traced back to care. Non-communicable diseases. The impact of the pandemic was further felt on the management of non-communicable diseases as fewer clients were screened for conditions such as diabetes and hypertension. Informed by the above, at our strategic planning session, we assessed our performance over the recent past years and drew a roadmap for this financial year. Our outlook is dedicated towards progressively strengthening the primary health care in line with this system. Also shall towards the successes of this model that we are confident shall further improve our endeavors in ensuring that all citizens of the Free State have access to quality health services. Speaker, we also wish to express our immense gratitude to the SASO firm, World Health Organization, UNICEF, ESCOM Foundation, DG Murray Trust, Right to Care, VETS, RHI, the Solidarity Fund, the Transport Foundation, Education, University of the Free State, Central University of Technology, Red Cross, Beyond Zero, and others for their roles in providing material support for our fight against COVID-19. As the country ushers in the district development model, we shall not be left behind, as the model would propel us towards the realization and monitoring of the national health insurance. Speaker, I rise to table the 2022-23 total budget of the Department of Health in the Free State, amounting to 12,711,441,000 rand, which represents a marginal increase of 0.9% on the 2021-22 allocation against the headlines. PI projection of 4.2%. This budget is distributed amongst the following budget programs. Administration, it's let me not read this, you see them in the speech. This budget will impact positively on the lives of Free Staters, whilst directing us to fulfillment of our vision of delivering a healthy and long life for Free State community. Alongside this noble vision is our mission of providing accessible, effective, and quality health care services to our community. Speaker, we shall maximize the return on the funding allocated to the department as we ensure improved access to quality health services in our quest towards universal health coverage and increasing life expectancy for our people. It is now 8 years towards the year 2030, our target year for meeting the sustainable development goals, which are aptly expressed in the National Development Plan 2030. The clock is ticking, and every effort counts to change the fortunes of our world into a sustainable future that is characterized by the ethos and preservation, cooperation, collaboration, and human solidarity. Since the 11th of May 2018, when I assumed the stewardship role as the MEC for Health, I asserted that our focus would shift from inexpensive, unaffordable, curative, hospice-centered system of healthcare to a responsive and affordable preventative primary healthcare system. Ever since then, every effort has been directed at realizing this ideal. I have also cautioned that it would not be easy because we would be working against an established system that was meant for rich few at the expense of the masses, and that our disruption would be resisted unless it was strengthened by a formidable force such as the National Health Insurance. This budget speech will therefore give an account of how far we have come and what more we still need to do to change the fortunes of our people. Program 1, administration. Healthcare service provision is highly human resource intensive, and healthcare workers remain our most crucial asset. For that reason, the department is completing the review of the organizational structure, which we anticipate finalizing in the 2022-2023 financial year. The staff establishment currently has a total of 22,822 approved posts, with 16,933 filled and 5,252 vacant, which equates to a vacancy rate of 26%, which is too high. The allocation for compensation of employees has decreased over the years, and this has made it difficult for the department to fill the posts and appoint the number of officials needed to achieve our mandate. As a result, 5,252 posts are currently frozen. In this financial year, we will endeavor to fill the 637 active vacant posts while prioritizing critical posts, but mainly the clinical ones. During the 2022-23 financial year, a recruitment drive was undertaken to reduce the vacancies of medical officers through the Presidential Stimulus Package grant. A total of 34 medical officers who were government bursary holders and 956 nurses were employed. This significantly reduced the vacancy rate to meet the demand for health professionals in whom we have a high turnover. The retention strategy is under review to mitigate the skills losses for these cadres. The department, amid COVID-19 Alert Level 5, has promoted qualified nurses that completed bridging course through Free State School of Nursing for career pathing to improve nursing care. Speaker, the rollout of COVID-19 vaccine program would not have been successful if it were not for enabling technology. The effective use of electronic vaccination data management system at all sites in the province is evidence of the readiness of the department to embrace the fourth industrial revolution to improve health outcomes. Additionally, the department made significant strides in digitizing support functions to improve operational efficiencies. These include the implementation of an online learner management system for the Free State School of Nursing and the EMS College. Through collaboration with the University of Free State and the World Health Organization, we were able to develop cutting-edge technology to assist the department to track, trace, and manage COVID-19 cases. This year, working with the State Information Technology Agency, SITA, we will begin implementing an integrated patient care information system in our large hospitals. These will enhance continuity of clinical care through real-time patient data, mitigate against medical legal exposure by using digital patient files, and maximize patient revenue collection. Other noticeable projects that are currently underway include the development of an electronic invoice tracking system to monitor the payment of suppliers in 30 days as prescribed by the PFMA. We will also utilize electronic information security measures such as CCTV cameras to complete our security personnel, especially to complement our security personnel, especially at the facilities where we keep losing critical assets. So, shortage personnel security. We are going to use CCTV cameras to assist, to complement the security personnel. Quality assurance. The department started to implement the ideal hospital framework in 2019 in preparation for the NHI accreditation. In the past 2 financial years, the COVID-19 pandemic has impacted negatively on the performance of our health facilities and related assessment outcomes. However, in 2021-22, the Boitumelo, Bongani, Ditlhabeng regional hospitals, as well as Pelonomi Tertiary and Universitas Academic Hospital, achieved the ideal hospital status. Speaker, we acknowledge that half of our PHC facilities do not meet the threshold to be defined as ideal clinics. Prior to COVID-19, we were at 69% compliance. This declined to 43% in 2020 as a result of COVID-19, and we have shown signs of recovery with the achievement of 54% in 2021-22. The department is committed to ensure our facilities regain the ideal status. This we will achieve by making critical appointments such as operational managers, cleaners, and pharmacy assistants. Much of our efforts will also go into conducting ongoing maintenance, which have suffered partly because of funds being reprioritized in response to COVID-19 pandemic. The initial implementation of the Ideal Hospital program started in 2019-2020, where 13% of the district hospital achieved the ideal status, which increased to 50% in 2020-21 and declined to 44% in 2021-22 due to the COVID-19 pandemic. The department will focus on continuous quality improvement to ensure we are NHI ready. Program 2 is district health services. Speaker, I have already outlined the performance of this program when outlining the impact of COVID-19 pandemic. Indeed, the HIV testing services and the initiation of eligible patients on treatment were negatively affected. A provincial catch-up plan is being progressively implemented to improve performance. Weekly accountability monitoring meetings were introduced to monitor HIV testing services and treatment initiations, focusing more on children under the age of 5 years. To address the challenge of the health-seeking behavior of males, this intervention will also focus on men. In addition, same-day ARV initiation of HIV-positive patients, 6 monthly drug dispensing, including decanting of stable patients for central chronic medicine dispensing and distribution, and external pickup points is continually expanded to all the facilities, and to date, 134,736 patients are registered on CCMDD. This has reduced congestions at the facilities. In this financial year, we shall focus on the following: distribution of 48.9 million male condoms and 750,000 female condoms. Counseling and testing of 646,918 people. 20,000 HIV positive patients will be started on TB prevention therapy. 32,664 eligible patients will be started on antiretroviral therapy. On the TB program, this year's TB Day theme is Invest in Action to End TB Now and Get Screened, End Stigma, Save Lives. The national commemoration of the World TB Day was on the 24th of March 2022 in the Northern Cape. The provincial event was on the 1st of April in Bethlehem. The total number of patients diagnosed with TB has declined from 10,266 in 2018 to 9,203 in 2019 to 6,256 in 2020. This matches the decline in PHC utilization rate. However, the TB 90-90-90 strategy showed more improvement to 91.3% of PHC clients screened, 94.6 treatment initiation, and a decline to 73.3 in patients who successfully completed their treatment. This is attributed to high number of deaths and patients that were lost to follow-up. We have intensified the implementation of finding the missing TB cases strategy, which was introduced countrywide. This includes strengthening of TB screening of clients in health facilities and household members of the index case, that will be community screening. In this financial year, we will focus on initiating 90% of eligible TB clients on drug-sensitive TB treatment. Tracking and tracing of treatment defaulters for loss to follow-up rate for drug-sensitive TB clients of less than 9%. Drug-sensitive TB clients treatment success rate target of 80%. Initiating 100% of eligible XDR TB clients on treatment. Maternal and women health. Maternal health is one of the priorities of the department, and we spare no efforts in our power to prevent avoidable deaths of mothers. The province has high maternal mortality ratio of 153.6 per 100,000 live births against a target of 125 per 100,000 live births, with the most affected district being Lejwe-Leputswa. It is to this end that the department has trained 80 healthcare providers on the essential steps on management of obstetric emergencies, ESMO-E, 36 on advanced antenatal care, and 20 doctors on management of emergencies during anesthesia. To mitigate the high mortality rate, a maternity hub has been created in Lejwe-Leputswa, where Bongani provides cesarean section for the district with the intention to capacitate Tusanung and Katlego hospitals to conduct deliveries. In addition, sterilization outreach services and low-risk elective cesarean sections are now provided at Albert Nzula Hospital. Teenage pregnancy. The department is on course to reduce teenage pregnancies and thereby contribute to reduction in school dropout rate. Strategies implemented include health promotion, messaging on healthy sexual behavior by increasing access to sexual reproductive health services to the youth. We have increased the number of youth zones from 50 to 122 in our facilities. To date, 70,066 children and teenagers aged 10 to 19 accessed healthcare services in the PHC facilities. Furthermore, the department collaborated with private health care providers to improve access to sexual reproductive health services. Despite the establishment of the youth zones, there is still a challenge with teenage pregnancy, where 10 to 19-year deliveries, which is a proxy for teenage pregnancy, is currently at 13.4%. against the target of 12.5%. It is our view that we need to work in partnership with the civil society in addressing this social ill. Child health speaker, one of our deliverables of the year was to establish pediatric hubs as a way of decentralizing specialized child health care services from regional to district hospitals. 3 district hospitals, namely Thebe, Fezinkube-Ntombi, and National, have recently established functional pediatric hubs, and the impact will be monitored monthly. In the new financial year, we shall establish 3 additional pediatric hubs as well to increase access of the specialized child health services. The expanded program on immunization is one of our child survival strategies. Community education has been maintained to improve our performance in this regard. Immunization under 1-year coverage is now at 77.4% against the target of 80%. The province has experienced an increase in deaths of children under 5 due to severe acute malnutrition, which has increased from 3.1% in 2021 to 9.6% in 2021-22. The following strategies are planned to address the above: community engagement and education of the communities on the maternal and child health services, collaboration with University of Free State and the schools of nursing has been established in improving skills of healthcare providers on maternal and child health, strengthening the intersectoral collaboration with the relevant government departments, for example, social development, to prevent and manage all forms of malnutrition in children, strengthening sexual reproductive health services to reduce unplanned and unwanted pregnancies, increasing the number of facilities implementing adolescent and youth services from 122 to 150, strengthening the provision of integrated school health program in early childhood development centers and schools, enhancing the capacity of delivery facilities to improve the care of women during and after birth, conducting immunization and vitamin A supplementation drive to decrease morbidity and mortality of children due to vaccine preventable diseases. Mental health. In total, 285,211 people were screened for mental disorders. Of these, 282,476 were referred for mental health assessment, and 1,374 were treated at primary health care facilities. During the 2021-22 financial year, 629 mental health care users who were lost to follow-up were traced back to care. The department is implementing the strategy to achieve universal mental health access, which include the contracting of mental health care practitioners. The 2 clinical psychologists who were contracted managed to provide psychosocial services to 514 mental health care users. Through the community health care workers, we have been able to trace 25 defaulters back to care during the 2021-22 financial year. In this financial year, the department plans to contract 3 additional clinical psychologists. We shall also reduce the backlog of forensic mental evaluations and treatment of state patients waiting in correctional facilities. The primary health care outreach. Ho matlafatsa phihlello ya primary health care, lefapha le ile la eketsa palo ya basebeletsi ba bophelo bo botle ba setjhaba. that is community health care workers, diterekeng tsohle tse hlano, ka ho netefatsa hore dihlopha tse 167 kaofela di sebetsa hantle, mme di na le baetapele ba tsona. Morero ke ho eketsa palo ya dihlopha tse teng hona jwale ho fihla ho tse 175. Sena se tla etsa bonnete ba hore dihlopha tse mabatoweng a ditereke tsohle, mme re se ke ra ba le di mabatowa a senang di-team tsa di-community health care workers ho ntlafatsa tshebetso. Ho fihla ha jwale lefapha le se le hirile basebeletsi ba bophelo bo botle ba setjhaba ba 2,423 e le karolo ya di-ward-based outreach teams tse ileng tsa fihlela 154 e leng 50% ya mabatowa a 309 ka hara province ya Freistata. Ketelo tsa malapa tse entsweng ke di-W-boards di eketsehile ho tloha ho 77,822 in 2020-21 ho ya ho dikete tse 116,023 ka 2021-22. Motsamaisi wa dipuisano ke rata ho thoholetsa letona la bophelo bo botle mohlomphehi Dr. Joe Phaahla ka kgatelopele e entsweng ke lekgotla la naha la bophelo bo botle NHC tlasa boetapele ba hae ka ho hlahloba maemo a hona jwale a mosebetsi le mahlomola a basebeletsi ba bophelo ba setjhaba. Ho matlafatsa ditshebeletso tsa bophelo dibakeng tsa mahaeng, lefapheng re rekile di-mobile clinic tse 20 ho ka fihlella bakudi ba dulang mapolasing. Program 2, Emergency Medical Services. EMS is crucial in ensuring access to various levels of care in line with the referral system. The service includes pre-hospital and inter-hospital transport, as well as the planned patient transport. Currently, we have average of 138 rostered ambulance, which is a far cry from the 270 that are required to provide an agile, responsive and effective EMS. Despite this anomaly, we continue to make amends by focusing our efforts on the improvement of response time. This has led to an improvement in our response time in rural areas from 65% to an hour to 84.2 and 55.4 to 56.5 within 30 minutes in various urban towns. Speaker, we acknowledge that the performance of EMS is not at the level it should be. Our biggest challenge is the lack of skilled staff, such as advanced life support personnel. In 2021-22 financial year, we were able to recruit 68 call center agents and 188 EMS practitioners. In this financial year, we are due to replace 50 ambulances through the government garage. To roster more of these ambulances, we will need to recruit the requisite skills. We are proud to currently be rostering 14 dedicated obstetric ambulances, which represents a marginal increase from 9 to previous financial year. This is we do in a quest to mitigate the maternal deaths. Additionally, we managed to operationalize new EMS stations on satellite model in Tueling, Orangeville, Fredefort, Clarence, and Ventersburg. In this financial year, we will open new satellite stations in Hope House, Allen Ridge, and advertise posts for advanced life support to enhance the rostering of obstetric ambulances and inter-facility transfer. We will operationalize the Harib EMS District Control Center in Tromsbeek. Provincial hospitals. The program is Program 4, is responsible for accessible, appropriate, and effective generalist regional hospital services, including rehabilitation services, as well as the specialized psychiatric hospital, to enhance clinical efficiency, treatment compliance, and continuity of care at primary health care, all of which will improve cost-effective. Hospitals will play an active role in providing outreach services, supervision, and support. The 3-feet model was piloted in Thabo Mfutsanyana district to decrease maternal and under 5 mortalities. Briefly, this is an accountable model that emphasizes that all maternal and under 5 deaths must be reported within 24 hours, reviewed within 48 hours, and the recording the main cause of death and addressing the contributory and modifiable factors. The review follows the patient's journey through all the different levels of care, and the quality improvement plans are developed and implemented, and with lessons learned to prevent recurrence. This model will be rolled out to other 4 districts in 2022-23 financial year. The regional hospitals will focus on strengthening maternal and child health by implementing the following strategies: strengthening the clinical governance, including monthly morbidity and mortality reviews, strengthening outreach to district hospitals, implementing and maintaining safe cesarean section site accreditation, conducting targeted training on IMCI and HBB and ETAT. Program 5, which is a central and tertiary hospitals. The purpose of this program is to provide tertiary health services and create the platform for training of healthcare workers. It includes the tertiary and academic hospitals to reduce tertiary referrals and improve access to specialized care services. Academic and tertiary hospitals conduct clinical outreach to various hospitals in the province. Pediatric orthopedics and pediatric cardiology departments undertook outreach to Dihlabeng, Mufumari Manapo Mopedi and Bongani regional hospitals. The Department of Anesthesiology provided outreach services to Botshabelo, National, Dr. J.S. Moroka and Albert Nzula district hospitals. The Urology and Dermatology Department conducts outreach to Bongani Regional Hospital. Speaker, we do not have a regional hospital in Mangaung and Karib districts. As a result, Belonomi Tertiary Hospital often experience an overwhelming demand for orthopedic services, which is heightened by the inadequate availability of theatre time, thus leading to backlogs. To address this, Albert Nzula is being used to perform specialized orthopedic operations on pre-booked patients, including those on the backlog at Belonomi Hospital. Similar programs were carried out at Bongani and Bitumelo Regional Hospital to the district hospitals in Lejole-Putswa and Fezile Dabi respectively. Pre-booked patients to other clinical disciplines were seen on outreach to various hospitals where surgical procedures were also performed, thus reducing burden of transporting patients to the tertiary services in Bloemfontein and reducing the backlog of theatres in Universitas Academic Hospital. A total of 125 medical officers were trained during this outreach visits. In this financial year, we will expand the program to all regional hospitals and include pediatrics, internal medicine, neurology departments. For these departments to undertake and fulfill the outreach programs, a significant number of critical medical posts will be filled. Batho ba rona ba se batla bonelo haufinyana le moo ba dulang teng ke di-specialists. We shall ensure compliance with the clinical governance policy, including the morbidity and mortality reviews. The 2 hospitals will attain the ideal hospital status in line with the regulated standards for health services. Program 6, Health Services and Training.
Honorable members, before we proceed, in the last sitting, I reminded the honorable members of what you may bring and what you may not bring in the House. And it was after surprisingly raised by Honorable Nanyana in the House that you may not bring these cans that you are bringing in the House. Where are the weapons?
Didn't you see the weapons, Madam Speaker?
Where?
We must also talk about the weapons that was there at the podium.
Honorable Nanyana, exactly what I'm saying to you, the matter you raised, and in fact, it was a reminder, and I made a reminder and a ruling on that such things should not be brought to the House. I said it here, I don't know where you were when I was talking about that thing. So please, honorable members, this thing, it started by one person. It was not there in the past, but it started by one person and the next person and the next. So please refrain from it, honorable member. Let us proceed with our speakers list. I will now allow Honorable Smith, the chairperson of the committee, to address the House.
Good morning, everybody. Honourable Speaker, Honourable Deputy Speaker, in the absence of the Premier, Nontombela, Honourable Chief Whip, Mr. Thabo Meko, Honourable Members of the Legislature, Executive Council, ladies and gentlemen, those are the open media. We have a great job to do. We hear it every day. Let's grow South Africa together. We must ask ourselves whether we are doing that. Are we actually committed to grow South Africa together? We have long advocated for a state-run preventative health scheme, free medical and hospital care, with special attention to mothers and children. And better access to health care is highlighted in frameworks such as the Reconstruction and Development Plan of 1994, the ANC National Health Plan for South Africa of 1994, development with the World Health Organization and UNICEF. Constitution of the Republic of South Africa 1996, the White Paper for the Transformation of Health Systems of South Africa 1997, and the National Health Act 2005. Now we must call for an urgent action plan to implement the universal health coverage in South Africa through the National Health Insurance without any further delay. We must do it now. The budget that has been tabled by the MEC for Health is indicative of a committed leadership that seeks to improve the lives of the people. This will make the people of South Africa and the Free State to be part of the work towards the attainment of ideal health care that ensures a long and healthy life for South Africans. We must be grateful as Free Staters to have a knowledgeable leadership at the Department of Health, but most importantly, people that are professionals in the business that they are managing. That is why we support the approach by the MEC for Health, who committed herself to ensuring that primary health care received premium status to enable our country to implement primary health care re-engineering. This is a preventative system that will surely save our country from spending millions of rand in admitting patients in hospitals. This system is geared towards ensuring that people don't get sick in the first place. Prevention is better than cure. The implementation of the NHI is imperative to transformation of the entire healthcare system into the preventative healthcare system that is responsive to the need of our people. The clarion call of Let's Grow South Africa Together is building on a rich history of 28 years of transforming our healthcare system. Our healthcare system was a racialist system that treated people according to the color of their skin. It is not gone. Do not make a mistake. We are not ignorant to the fact that we still have apartheid sympathizers that still want to see discrimination being perpetrated through racial profiling by medical and aid schemes. These anti-South African practices are an insult to the legacy of Nelson Mandela, who fought tirelessly to see a South Africa that is free from all forms of discrimination and injustice. Honourable Speaker and guests, we support the budget that seeks to heal the rifts of our past injustices by expanding the frontiers of care through the provision of quality health care services in our health facilities. It is our assertion that all South Africans should feel welcome in our health facilities, and we have seen this in practice. They must receive quality health care at all times, and we must be able to see value for money in what is being delivered to our people. Honourable Speaker, we know the MEC is trying her best to ensure that the Free State hospitals develop the capacity they need to provide healthcare services to people. The inability for regional and district hospitals to operate fully at their level places enormous burden on Pelenomi national university hospitals, because they end up having to carry the pressures of referrals from the regional and district hospitals. These go to these levels of care as walk-ins and thus undermine the operational flows of these tertiary institutions. We need to build the capacity of our health system to also lift the importance of services of mental health patients in our hospitals and in our communities. Mental health is one silent killer that has taken away the dignity of our people. You can imagine what happens to mental health patients who also suffer from the diseases plus the COVID-19. You can imagine what happens to the lives and dignity of those mental health patients that we see wandering dangerously on the highways, streets, and in communities. These people need care, and this requires more resources to give to the Department of Health to take good care of them. Let us join hands and support the department in this difficult task. They must not be alone. It's the odious task and doing all things at the same time. The MEC actually put it nicely when she said that they are expected to climb many mountains at the same time. This is an impossible task, but they are doing it. The evidence is recognition that the department received from the Presidency and Ministry of Health on its efforts to save lives during COVID-19 by ensuring that the eligible Free Staters are vaccinated and also take their booster vaccines. I'm guilty. I have not taken mine. I will. Let us be honest with each other, ladies and gentlemen. The department has also received the award of Best Doctor, Best Nurse and Runner-Up in the Best Clinic category during the National Bartupele Services Excellence Award. We must do everything in our power to support the Department of Health to give dignified health services during the lives of people, as well as to maintain human dignity at death. The department must be assisted to get the capacities it needs to strengthen the healthcare system of every level. At this point of time, I want to say yes, we support this budget. Madam Speaker, I have said a lot, but where do you start commenting on a 36-page budget report? The urgency of this report of the Department of Health and the effort that put into the support must be recommended. Let me start to give feedback on the committee's oversight excursion to a few of your health institutions. They are Boitumelo Hospital in Kroonstad, and Tabang Clinic, Vivian Mangwani Clinic, Naya's Rest Old Age Home, a mod home for the aged in Paris. In Sasolburg we visited ons Gryse Jeug Old Age Home, Riakakala Old Age Center, the Kuwara Clinic and the Fizin Kubeni Tombi District Hospital, and apologize if I didn't pronounce it correctly. It was very refreshing to be addressed in a professional manner, and the openness of the management, how they reported problematic issues that all rises from too little funding. These are not unsolvable problems, but with a clear indication that the department and officials are clearly doing their best to solve the hiccups that are heard about in the media. Please, Honourable Speaker, do not think that by using the word hiccup, that we are not taking the stress point seriously. Yes, we do take it seriously. Most of the time, it only needs just one match to light a fire. We enjoy the full attention we receive when sharing the going gossip of a person fighting for service delivery. Many times it is not service delivery, but the impatient Nunu who bid us. I will not deny that there are instances of slow services, but I will not confirm the public call of no services. There are services. I've experienced it. I personally found that I mostly only certain cultural groups complaining. The cleanness of the facilities we visited was a promising experience, and the general positive attitude among staff were very warm. In the midst of COVID-19 regulations, walking in the front lines with a strong arm of the COVID-19 fighters, our healthcare people, you felt safe with the assurance that you are among the real people who really cares about their neighbors' health status. The combined efforts of the different departments by name Health, Education and the Department of Social Development, and not forgetting the other MECs who contribute to the fight against this pandemic, must also be praised and the department support. I must thank all our healthcare employees for their continuous and selfless effort to make this problem safe. Honourable Speaker, I can with all assuring and honesty confirm the Free State Department of Health are working. They are striving to intensify efforts to improve the quality of health for our people in this province. We must not forget the stressful impact of TB, AIDS, and now the disease, probably the most spoken one of all others, COVID-19. The disease who affected everybody's lives, family, friends, employees, and strangers. Even those you did not know, but you felt the pain in the hard voices because you stood there and felt so useless for not being able to take COVID by the hair and shake it out of your dearest. With this said, I think it is now the right time to ask God for special blessings for those healthcare workers who lost a special someone to COVID-19 pandemic. This prayer includes those who have spoken a word of kindness just to console someone in distress. As of the 3rd of April, the rate of infections in the Free State shows we had 202,504 confirmed, 193,578 recoveries, and 7,654 deaths. Well done, our Department of Health, our people who did not hesitate to show and do the magic. Support. The fact that the department is always looking for fully qualified staff who understands the sensitivity of working with patients are also positive indication of commitment. South Africa successfully implemented the Nelson Mandela Fidel Castro Medical Training Program. This program is based on the principle of international solidarity with the people of Cuba. The Free State had 210 students in this program, and at the same time training departmental staff improving their skills. The Department of Health offered bursaries to its employees for them to excel in their individual careers. Application for such were between 28 February and 22 March 2022. The department provided computer training, digital literacy and Office 101 to 9 cleaning staff members that work at Propeller House.
Thank you, Honourable Smith. Your time has expired.
Thank you, Honourable Speaker.
Honourable Clinton.
Thank you, Speaker. Let's give credit where credit is due. MEC, you have a good formula in the public-private partnership with Sasol at the Fezi-Nkubentombe District Hospital. If all hospital management teams were as able and willing as that team, and as the committee saw at that hospital, other similar partnerships will follow, I can guarantee you that. So you need the private sector, even more than NHI, but they need that commitment from you. And it's actually sad that the MEC did not even mention Sasol's commitment of millions to improve the lives of that community, and I would have hoped that the committee chair would maybe mention that. Now to the business end. Speaker, the ANC's attempt to discredit the opposition for voting against a budget is not only malicious, but misguided and manipulative. See, policies guide budgets, and we are not necessarily voting against services, but the guiding principles that allocate money to departments. So let's look at health. Yes, there's a decline in management salaries in the past 4 years under administration, but there's an increase, a steady but noticeable increase in the MSD's office from 9.7 million in 2019 to 12.4 million in the new financial year. In the meantime, there's a shortfall for clinical positions. In fact, of the 8 billion rand budgeted for the cost of employees this year, only 12% are for clinical personnel. We need more money for doctors and nurses, MEC, not for top of the food chain administrative personnel. On that note, MEC, it's unwarranted for the department to take months to approve positions in hospitals. The committee heard how some hospitals can't even fill vacancies since the department only approved these posts late in the financial year, and hospitals become in danger of having to start the whole process from scratch. Speaker, we are renting one emergency helicopter at 12 million per year. We could have bought our own helicopter years ago, and with the difference on the renting, we could have started saving for another. But rather, we are paying some cadre 1 million rand per month. The lack of maintenance of medical equipment and infrastructure under Program 2 continues, and the department acknowledges that compliance or non-compliance companies and slow-paced contractors are keeping services from the people. And the mere mention of terminating contracts will possibly result in litigation processes. Speaker, on the subject, we see yet another HOD being arrested for alleged fraud, corruption, forgery, and money laundering. So, Speaker, that's why we vote against budgets. We vote against the ANC policies of these allegations, these numerous legal battles. We vote against priorities wrongly and enriching a few at the cost of the people. Thank you.
I'm the one who's going to tell the member when their time has expired. I don't need any assistance. Honorable MEC Goloi.
Helicopter. Thank you, Honorable Speaker, Honorable Deputy Speaker, Honorable Premier in absentia, Executive Council, Honorable members of the Legislature. Honorable Speaker, the Freedom Charter as adopted by the Congress of the People in Cape Town in 1955 set out the vision on health to be, I quote, a preventative health system shall be run by the state. Free medical care and hospitalization shall be provided for all, with special care for mothers and young children, close quote. In 1994, when the democratic state came into existence, this noble document was incorporated into policy and as the ANC-led government. this remains the commitment that we aspire to realize. As the ANC, Honorable Speaker, we support the tabled Vote 5 budget, MEC Monsensiu, because it demonstrates the progressive trajectory towards strengthening the primary health care, especially in favor of those who is unable to afford it. Apart from the investment in new clinics, community health centers, and other infrastructures over the past 10 years, this department, Honorable Speaker, attributed to job creation during such construction. Affected communities employed in those centers and those very same communities will have new medical facilities. Furthermore, this department will have injected more than 97 billion rand into the economy over the past 10 years. On clinics, Honorable Speaker, this department has enrolled all primary health care facilities that started in 2015 in preparation of national health insurance and accreditation by Office of Standard Compliance. Not the helicopter. This department doesn't need any helicopter because it is going to be cost effective for the department to utilize a helicopter. In the past 3 years, 81% of the PHC facilities managed to attain ideal clinic status. This department is committed to ensure that all facilities are maintained to the ideal status. It will achieve this by making critical appointments such as operational managers, cleaners, and pharmacy assistants. Madam Speaker, Mangahumeto has the highest population in the Free State and only has 2 district hospitals that cannot accommodate the largest population and referrals from other districts. The Metro has 5 primary health care facilities offering 24-hour services to reduce the pressure to the district hospitals. And it is therefore that I commend to Honorable Monsensiu with your team for achieving less with more. Le sebeditse ka thata and le ntse le sebetsa and le tswellang despite the challenges that the department is faced with. The department.
Honorable MEC, may I please pause? Honorable Khakha. Switch off the mic.
Thank you, Honourable Speaker. Honourable Speaker, I'm rising to find out whether the MEC is willing to receive a clarity-seeking question.
Are you prepared to take a question, Honourable MEC?
Thank you, Honorable Speaker. Not yet, and not now, Honorable Khakha. The department, Honorable Speaker, will focus on increasing facilities in areas of the province that requires it. However, we notice the challenge of shortage of staff and minimal budget that is unable to attend to daily operations. Jwalo ka ha baahi ha be re tseba kapo ka nako tse ngata Speaker, baahi ba rona ba province ya Free State e sale balla ka hore ditleliniki kaofela ka hara province ya rona di sebetse 24 hours. Mme hona ho baka bothata ho department hobane budget e lefapha le fumana e tlase haholo ebile hape ya haella ka manese empa re rata ho theolotsa mme Monsensiu hobane selemong sena sa 22-23 hona le manese ao letlang ho a traina ho bona hore ditleliniki ditoropong tse leng hore hona le phephetso le eketse nako ya teng ya di hour hore di patient tsa rona di kgone ho fumana ditshebeletso tsa mantlha. Honorable Speaker, the emergency medical services is crucial in ensuring access to various levels of care in line with the referral system. The service includes pre-hospitals and inter-hospital transport as well as the planned patient transport. Currently, The department has 138 rostered ambulances, which is a far cry from the 270 that are required to provide an agile, responsive, and efficient EMS. This had led to an improvement in the department's response times in rural areas from 65% within an hour to 84.2% within an hour, 55.4% to 56.5% within an hour in various urban towns. Honorable Siu, the improvement does not go unnoticed. Re a leboha ka mosebetsi o kgabane. Re rata ho lo theoletsa ka hore commuter transport nakong e tlang le tlo di fokotsa le etse bonnete ba hore di specialist tsena tse re di bonang dipetleleng tsa rona mme Montshentshiu di tswa ka hara dipetlele di ya haufinyana le ditshebeletso mane ma-questioning a rona di-clinicing ho bona hore bakudi bao e leng hore ba fumana ditshebeletso tse e leng hore di ikgethile di-specialist tsa rona di kgona hore di ye ho bona hobane ho nka nako hore bakudi ba rona ba tlohe kwana mo ba leng teng dibakeng tse fapafapaneng ho tla Bloemfontein. Re rata ho theoletsa hore o ntsha di-specialist ka hara Bloemfontein o di isa bathong mo bakudi ba leng teng hore dingaka tsa rona di ye ho bona ba se kene ba tswa ka meso ba tla mona Bloemfontein. Re a leboha mme Monsensi. Honorable Speaker, the Community Health Care Workers Program is one of the 3 streams of primary health care, re-engineering, and a key community-based services. These community health care workers are responsible for tracing for clients who have defaulted on their treatment, mental care users who are lost in the systems, identify women who are not aware of their pregnant status, and all of these clients are referred to the correct level of care. Community health care workers are also trained to identify social determinants of health, which are then referred to the correct sister department. Re rata lo theolotsa hape mme Montseng re di bone this care health workers le ka program ya ho entle mane dihlabeng mo ineng e le hore o no commemorate letsatsi la rona la TB mo re boneng kaofela basebeletsi bana ba setjhaba ba tlile ka magalo a fapafapaneng ibile ba eleliswa setjhaba ka mahloko a fapafapaneng. Mosebetsi o motle wa babatswa le ha hona le diphephetso mme Monsentshiu. Honorable Speaker, to date, the department have appointed 2,423 community health care workers as part of the ward-based outreach. The ward-based outreach teams that have covered 154, that is 50% of the 309 wards within the Free State province. The household visits conducted by these WBOTs increased from 77,822 in the year 2020-2021 to 116,023 in 2021-22. Well done, Me Monsensiu, the department ya hao. Honorable Speaker, to improve access to specialized care services that is only available at academic and tertiary hospitals, the department is conducting clinical outreach to various hospitals in the province. Services such as pediatric orthopedics and pediatric cardiology departments are now providing outreach programs to Dihlabe, Mufumadi, Manapomopedi, and Bongani regional hospitals. These are some of the few services that the department is offering in different hospitals. Pelinomi Tertiary Hospital often experiences an overwhelming demand for orthopedic services, which is heightened by the inadequate availability of theater time, thus leading to backlogs. To address this, Albert Nzula District Hospital is being used to perform specialized orthopedic operations on pre-booked patients, including those on the backlog at Pelinomi hospitals. Honorable Speaker, around the infrastructure, the progressive budget reflects on what is to be done as it will refurbish the following facilities: I also commend you, Memonseng le team ya hao. Tembale 2 Clinic, Halala Clinic, Doctors Accommodation at Dr. J.S. Moraka Hospital, Emergency Medical Services in Kwakwa, OR Tambo Clinic in Virginia, Hudson Clinic Velcom, Masilo Clinic Thenazen, Hudson Clinic in Botaville, Kopano Orthotic and Prosthetic Center in Velcom, Maternity Wing at Bongani Hospital, and other wards. The following facilities will also be refurbished and we also recommend you, Memonseng. Doctors Accommodation at Bosabelo Hospital, White Block at National District Hospital, Free State Manapo campus around nursing campus. Madam Speaker, this department will also be completing an upgrade, refurbishment and renovations of the following facilities: Backen Park Clinic in Bethlehem, Leraton Clinic in Allen Ridge, Sepon Clinic in Forquer de Flay, the HVAC at Universitas Operating Theatres, 6 of 11 theatres completed in 2021-22. It is important to note that apart from the above existing facilities, the department will be building new clinics, which are Tandanani Clinic and Raiders Park Clinic in Velcom. I believe ba ahiba Velcom finally batabilo ban esale balla ka ditliniki tsena tse pedi ka nako e telele. Madam Speaker, the mandate of the Department of Health includes other health support services such as the emergency medical services, mortuary nursing colleges, medical depots, and various other services. The other facilities under planning includes the following: New Fentersburg EMS station in Mabahabani, new forensic mortuary in Velcom, Lejeleputso. The department is further focusing on upgrading the laundry and kitchen services within their facilities. In conclusion, Madam Speaker, despite the challenges that arise daily, this department has displayed a great alignment to targets set by the National Development Plan and the poor policy of the ANC manifesto. We support this budget, Honorable Speaker. Thank you, Memonseng, ka mosebetsi o motle wa lefapha le baahi ba mapolasing ra ba lebohela ka di mobile clinic tse 20 tse tla ba fihlella mapolasing. Ke a leboha.
Thank you, Honorable MEC. Honorable Nanyane.
Madam Speaker, honorable members and distinguished guests, ke a le dumedisa. Madam Speaker, the EFF would like to once again encrypt in the Free State Legislature Hansard a message that would even be difficult for the likes of white-collar crime perpetrators as depicted by PricewaterhouseCoopers in the referral officials in our systems. In the provincial government, individuals who are hell-bent to do the dirty work to their political masters to exchange for their social standing and career. Madam Speaker, the South Africa has moved third in the top 10 ranking of countries with the highest reported economic crime in the world. The significant increase of financial statement fraud is concerning, as this type of fraud invariably involves senior management and the amounts are significant. The negative effect of this crime on all stakeholders and future sustainability of entity can be catastrophic, and yet you keep on selling us your sugar-coated lies, and the little charade must stop and stop immediately. Madam Speaker, the economic crime perpetrators by senior management are often amongst the are often amongst the most nested because of the ability of political head and executive override internal controls. The department has excessive irregular expenditure from 2017 and 18 financial year until now, which in the last financial year was 441 million and nothing has been done. The department has proven to be problematic with excessive unauthorized expenditure. In the main, over 2 of the project, and we believe that the current allocation is illogical. We do not even have a vaccine rollout, and the targets are not well thought through, and there is no sober individual who will support such. Year in, year out, we are informed about a lack of consequence management, and nothing remain and things remain unchanged. In program 2, Madam Speaker, what a fast comrade, Kapokiona Nyaupe, Moeza Mailente, you deliberately submit supporting evidence that materially.
Manyan, you've got to withdraw that. It's so unparliamentary. Withdraw that. You cannot say in the speech of the MEC, Kimo Nyaupe, it's a Mailente. Withdraw that.
Madam Speaker, when I'm saying Kimonya Upilza Mailente, I'm only referring that Kibushanya Mobuza Mailente.
Honorable members, order. Honorable Nanyana, withdraw what you just said.
I withdraw, Madam Speaker.
Honorable Khakau.
Honorable Speaker, I rise on a point of order again on consistency. In last week's debates and the debates preceding those, in this House, members sitting on that side of the House have constantly referred to us as either puppets, as either racists, and all sorts of words that I do not comprehend you calling them out, any of them out, and asking them to withdraw their statements. Because you say that you cannot dictate the content of a person's speech. However, now you heard a person say something that is offensive, given whoever receives it. And now you have a problem, Honorable Speaker. Now all I'm requesting for you is in your rulings on what can say what to who, when, and how, please be consistent.
Honorable Khakha, you could have just stood up and raised a point of order on whoever said something. You cannot keep referring to the previous sittings that maybe you raised something and the ruling was made differently. That is not assisting me. And you consistently try to undermine the presiding officer, myself in particular, whenever I'm sitting here, and tell me I'm inconsistent and this and that. I'm not taking kind to that. All I'm going to request to you is to say there is a member that said this, so that I can rule in that. Standing up there and say all these things that you are saying is uncalled for. It is uncalled for. And I'm not going to respond the way you are talking to me, because I respect this seat where I am right now. You raise an order and say this particular member has said this, so that I can rule on that. Generalizing and even refer to things that are untrue is not helping me to make a ruling. I'm talking to you. I'm waiting for the point of order you want to raise. What you raised is not a point of order. I want the honorable member that I gave platform who wanted to raise an order to raise the point of order.
Honorable Speaker, I did rise on a point of order, but let me rise again on a point of order. My point of order is on you as the presiding officer.
Then you are out of order. Sit down. Sit down. You are out of order. Proceed, Honorable Nanyan. No. She cannot raise a point of order on me. If she had something that is said by a person, raise what the person has said, so that you cannot raise a point of order on me. What do you want me to do? To sustain the point of order on me? No, go and read your rules, man. Proceed, Honorable Nanyan. Proceed, Honorable Van Vuren.
Honorable Speaker, you try and tell us that we must have respect for you. She rose on a point of order.
What was the point of order?
She clarified the point of order that you are not consistent. So she requested you just to be consistent. And then you sort of lost it because she not reprimanded, she actually asked you nicely to be persistent. And she explained why. And it's not the first time.
Honorable members, when there is a member on the platform raising a point of order, give me a chance to respond to that point of order. Don't raise a point of order on top of the point of order. Allow the honorable member on the platform so that I can respond.
So we don't want to be disrespectful. I'm talking nicely to you, and I said the manner in which you spoke back to her, that was uncalled for. It's all well and fine if you explain to her why you did it and what you did. But every time we raise a point of order like that, you say, listen, you cannot raise a point of order on me. But how do we have to speak to you to actually ask your assistant to just be consistent?
Okay.
It's difficult for us to do that. Who do we raise a point of order? Just if you can tell us that, we will do that. And try our best to be. And I understand the honorable member there.
You may take a seat, Honorable Nanyan. Honorable Van Vuren, I said it last week. When a member is not happy with the ruling made by the presiding officer, there is a process where you can refer that. You cannot, let me finish, I waited for you to finish. You cannot stand up and say point of order to the speaker, because I will not. It's just logic. I will not be able to rule on myself. Hence, I advised you last week to say, if there is an order, that a ruling that you are not happy with, you must go consult your rules on the processes you might take so that you can be able to raise that. But what I'm not going to accept is for Honorable Khakao, every chance she gets, she will stand up and lambast at me and tell me how inconsistent I am every time she gets that. All that I'm saying to you, Honorable Khakao, in the house, you raise your hand and you said that member is saying 1, 2, 3. That is going to help me to be able to rule. But now, instead of saying that, you are saying you always do this, you always do that, of which is not true. It is not true. There is no member that when a point of order has been raised, I don't rule in this house. It is not true. I'm still waiting for you to raise a point of order, but you made a generalized statement. Is that still a point of order?
Speaker? Yes, Speaker.
Proceed.
The problem we have is not the ruling that you make, or if somebody stands up and say, I raise a point of order because of something that you stop the person there, or you stop one of the members here and tell them, listen, you are out of order, you are not allowed to say this or that, because it's unparliamentary. But what she says is, you're not consistent in applying that same rule towards the ruling party as to the opposition party. Because she says, you let some of the things go away, you interject, and you stop them. We're not talking about when somebody stands up and asks somebody to actually stop and on a point of order.
I think my answer is still the same. When all of you are speaking at the same time, it's not easy for me to pick up who is saying what. That is why it's going to help for you to say that member is saying this, so that I can respond. And if you feel that I am not doing anything about the situation, then you refer the matter, let me tell you what the rules say now, to Standing Rules and Orders Committee. That is why you refer the matter. But for you to be able to stand up and lambast at me, tell me how inconsistent, I'm not going to take time to that. Honorable Chief Whip.
Speaker, thank you.
Is that a point of order?
Point of privilege. Speaker, we're not only accepting your ruling because it is logical, but it is also consistent with the rules and policy. In our view, people are not disagreeing with your ruling, but they are revolting against the rules which they have adopted. You are correct. This thing must be taken to a relevant program. For instance, Honorable House stood up here, declared that she doesn't understand to work over units. She referred to this in herself. Today she wants to understand what does work mean. You have been taken for the granted. Your ruling is relevant. Can you please proceed, Speaker, and avoid this?
I think let us proceed, honorable members. What did he do wrong? He rose on a point of privilege. I can't even rule. He is voicing his views, raising a point of privilege. What am I supposed to do? Stop him. Raise it.
Honorable Speaker, I rise on the point of privilege. Again, the point is this. Consistency, you said you need examples. Here's a perfect example. Sitting after sitting, you make rulings on whatever you want, and then whenever any member wants to rise and say something after you rule, you do not even allow us a second of breath or to utter anything to hold the chance to sit down. The chief whip of the majority party just stood and did exactly what you do not allow any of us on this floor to do, and it was okay. And again, you said no, but it's okay, you can't say anything because he's rising on a point of privilege. That is the point exactly. The matter of consistency is this, Honorable Speaker. What happens on the left must happen on the right. The equation must balance. All animals must be equal in this form.
You raised your point of privilege, and I'm prepared to proceed with the sitting. Proceed, Honorable Nanyan.
Thank you again, Madam Speaker. Madam Speaker, on program 7, there is an old saying that says, feed them lies for the longest of time, over and over again, until you convince them, and at the same time goes hands in hands with your adjustment of material misstatement, comrades. You either choose side of the coin, you are fraud or error. Hence, you did not submit your financial statement in accordance with the prescribed financial reporting framework as required by Section 40, subsection 1B of PFMA. Nonetheless, we now know that your modus operandi is to receive a qualified opinion at the end of the day, misstatements. Your expenditure management 369.5 as disclosed on note 9 could have been prevented as required by section 38, subsection 1C2 and Treasury Regulation 9.1.1 if effective and appropriate steps were taken, but no, it's our time to eat, comrade. Similarly, most of the irregular expenditure disclosed in the annual financial statement was because of expenditure incurred in our contravention of supply chain management legislation. It is also resulted in your failure to pay service provider within 30 days as per receipt of an invoice, thus contravening Treasury Regulation 8.2.3. Honorable members, there is no consequences management, hence no disciplinary steps were taken against the officials who had incurred are unauthorized expenditure as stipulated by section 38(1)(h)(3) of the PFMA, meaning that this day no investigation are being pursued into all irregular expenditures. Comrade, it would seem that you have taken over from the capitalist only for you to be capitalist yourself, and Karl Marx had this to say, and somehow his teaching are squarely directed to you, or either way, you socially will address this question, the society will address this question one day. Marx said, I'm saying again, Marx said that the law,
Don't do that.
Marx said that's the law. It is the mechanism by which one social class, usually referred to as a ruling class, keeps all the other classes in a disadvantaged position. Thus, the EFF is using this schooling of Marxist lens through which inter alia to consider the criminalization process, and by some of the acts are defined as deviant, whereas other are not. We are therefore interested in political crimes, state crime, and state corporate crime. Madam Speaker, in closing, the internal control deviances sharply raised by the Auditor General paints a devastating picture in this chapter. We are in because all that you did was to come up with corrective measures instead of preventative measures, and that is supported by your constant disregard of the legislative measurement. For those in power, violence is the ultimate threat to control those without power. Poverty, seizure, and incarceration is the threat for those who disobey. So for Marx, it's not surprise then that violence is a means of redistribution, and that wealth by those willing to engage in violence. Protect me, Madam Speaker. Honorable Kabati started again. Alternatively, the state should build...
Honorable MEC Kabati, please, order.
Madam Speaker, alternatively, the state should build massive capacity in healthcare and remunerate medical practitioners in a way that attracts the best medical practitioners to the public healthcare sector. As an immediate program, the state should regulate the cost of medicine and healthcare position to prevent private hospitals overpricing medical care, which is a basic human right. Secondly, Madam Speaker, the EFF will move with speed to set up a state pharmaceutical company to decisively intervene in the production of distribution of medicine. Thirdly, Madam Speaker, I don't know whether, Madam Speaker, you see what is Mekabat is busy doing. Thirdly, Madam Speaker, the EFF will urgently engage with doctors and nurses union, including general staff unions that operate in the health sector, to exert working class power and control the health system with a view to improve the quality and quantity of health services. Issues that must be urgently addressed will include remuneration and career path, skills development and training, as well as the establishment of norm and standard for quality health services in the clinics and hospitals. Till we meet again, as we usher and welcome a new sheriff in town. Thank you. Jay.
Honorable Khadele, honorable members, can you please refrain? Honorable Nanyana, you are not supposed to walk there. No, no, you are making things worse. You are making things worse. You cannot make such threats in the house. You are not supposed to walk there. Nobody is supposed to walk there. Honorable members, please refrain from making comments while the speaker is on the podium. I'm sure that is not difficult to stop. Please refrain from that. These comments that you are making are not helping the process, because the members will then raise a point of order, will then have to stop what we are doing and focus on that. And it's just wasting the time of the House. And at all material times, I want to urge you on this podium and in this House to use the words that are parliamentary. Proceed, Honorable Khade.
Yes, Speaker. Some of us are not here to promote some hullabaloo during the proceedings. We will forever kowtow by the rules and orders that dictates the process of the House. Honorable Speaker, the African National Congress has made health a top priority for all South Africans. The supreme law of the land, the Constitution, guarantees this. Section 27 of the Constitution provides that everyone has the right to access healthcare services, including reproductive healthcare services, and no one may be refused emergency medical treatment. We, however, note that access to healthcare for most South Africans is influenced significantly by their socio-economic status. The population of our province who rely on public health care facilities is negatively affected by inadequate infrastructure and health personnel. Our communities continue to be concerned about emergency transportation and long wait times in our public health care facilities. Given to these challenges in the provision of access to health services, the Department of Health is spearheading reforms which aims at changing the inequalities within the health system. The fight against COVID-19 is a good starting point for demonstrating that the ANC government is unwavering in its unwavering commitment to taking reasonable measures within its available resources to ensure progressive realization of the right to healthcare services. The year 2022 marks 2 years since South Africa recorded its first ever COVID-19 infection. Never in the history of our democracy has our country been confronted with such a severe situation. This was a medical emergency far graver than what we have experienced in over a century. The emergence of dangerous coronavirus variants led us to believe that we were losing the battle against the virus. The death rate continued to rise exponentially, and virus mutations caused a serious setback for vaccine plans. The virus transformed nearly every aspect of our world. We saw a dramatic shift in how we do our jobs, eating habits, childcare, and even our collective sense of time. The uncertainty of whether we have a job to which we can return was most certainly high on the list, but the parents, it was an anguish of a sudden unstructured life where their children's education has to become visual and visually non-existent. We were all faced with the problem of having to decide what to do next. At this point, we remembered Thomas Jefferson's words when he said, I quote, Nothing can stop a man with the right mental attitude from achieving his goal. Nothing on earth can help a man with the wrong mental attitude. Close quote. The government put in place strict lockdown measures, closing borders, enforcing curfews, and even banning alcohol sales to prevent reckless behavior caused by drinking. We understood that there were times when political doctrine needs to give way for pragmatic action. The Department of Health immediately established a COVID-19 command center to focus on providing overall strategic directives to the department. The department ensured the tracing of all those who have been in contact with COVID-19 and the subsequent isolation of people who were infected. It took a conscious decision to work on preparations for field hospitals and reprioritize its healthcare workers to help with the COVID-19 services. The chronic shortage in staff in its facilities was mitigated by the inclusion of communal care workers. The department opened its hospitals, wards, and ICU beds for COVID-19 related admissions. It strengthened the use of personal protective equipment in its facilities. Overall, the department ensured the implementation of safe, effective, and efficient vaccination program to halt the spread of COVID-19 and help bring pandemic to an end. Honorable Speaker, the ANC is encouraged by the Free State Department of Health commitment to improving people's health and overcoming COVID-19. We are encouraged by the department's commitment to ensure availability of vaccines to cover the population of the Free State. We are confident about the aggressive effort of the department to counter vaccine hesitancy. Vaccination remains the best way to fight COVID-19, and we call on everyone to vaccinate without further delay. Booster shots are now freely available to most people, and the ANC calls on those who are eligible to get boosted as soon as possible. We, as the African National Congress, applaud the department initiative to set up a pop-up vaccination site and suggest that they be used to provide additional services such as blood pressure checks, screenings, and routine childhood immunization for children who may have missed their shots, particularly in rural areas of our province. The number of new infections continues to decline as a result of our increased awareness and vigilance. And we would like to take this opportunity to thank the ANC-led government led by Mrs. Ntombela and Honorable Metsi for fostering that Thomas Jefferson called the right mental attitude to achieve goals. We thank His Excellency Undade Ramaphosa for following the World Health Organization authoritative advice, which called on all countries to implement decisions that are evidence-based and convincing. We thank our healthcare practitioners and staff for fighting against COVID-19 spreading, including sharing the information of the disease transmission, epidemic knowledge, and sharing the experiences on case management and treatment approaches. The ANC wishes to thank the people of the Free State for fighting against stigmatization, since the stigmatization is always present when the disease outbreaks. The roots of dysfunctional health system and the collision of epidemics of communicable and non-communicable diseases in South Africa can be found in policies from periods of the country's history, from colonial subjugation and apartheid dispossession, racial and gender discrimination, the migration labor system, the destruction of family life, vast income inequalities, and extreme violence have all formed part of South Africa's troubled past. Chronic diseases, especially cardiovascular diseases, Diabetes, chronic respiratory diseases, and certain cancers have steadily emerged as a major threat to health across the spectrum of South Africa's diverse racial and social class groupings. All these factors need to be addressed by the ANC government to improve health and achieve Millennium Development Goals. Our view shows that increasing attention is currently being paid to communicable diseases in our province. However, this is heightened focus must be strengthened and sustained over the next financial year to combat the current trend and achieve a reduction in non-communicable disease burden. The chronic character of these diseases demands long-term care, and they impose a continuous burden on already overstretched health system due to COVID-19. Non-communicable diseases can deepen poverty, reduce economic productivity, and strain already under-resourced healthcare system. The Department of Health needs to invest in non-communicable diseases prevention and control as an integral part of sustainable socio-economic development. Chronic diseases interventions should be targeted as a risk factors and determinants. The approach for dealing with chronic diseases needs to go beyond medical treatment for those who are already affected. The ANC encourages the department to take promotion approach, which suggests that comprehensive and intersectoral solution is the way to go. It would also includes primary prevention within a life course perspective that prevention must start before birth, moving through infancy, childhood, adolescence, adulthood to old age. We need to shift our focus on management and control prevention of complications amongst individuals who are already diseased. We call on the department to take up proactive programs like community prevention programs to influencing behaviors and health beliefs in our communities. The physical inactivity or sedentary lifestyle is a defining characteristic of a modern life, especially in urban regions. This is a concern because physical inactivity is a risk factor for many non-communicable diseases. Therefore, we need to spread the message of ensuring an active citizenship in our province. We should at all material times seek to empower people with knowledge and understanding of health and to create conditions conducive in pursuing health lifestyles. The ANC acknowledges that substantial improvements in health cannot be achieved without improvements in socio-economic conditions of our people. We need to pursue with greater determination poverty alleviation, unemployment, and address inequalities, because it is the only way that we can encourage and motivate our province to think and act in favor of our health system and to remember that development is impossible without health. Yes, Honorable Speaker, we commend the budget vote in its current form and pledge to ensure that it fulfills its promises and more. I thank you.
Honorable Peter Way.
Thank you, Honourable Speaker. Thank you, Honourable Speaker. Madam Speaker, here we are in our third year of a pandemic that no one expected in their lifetime. The global pandemic came and changed our lives forever, and we are living now what we are referring to as the new normal. But this pandemic also exposed the serious trouble in which the Free State health system finds itself. At the the beginning of the pandemic, we were promised no less than 1,000 professional nurses would be employed to support the understaffed health facilities in the Free State. Yes, the Honourable MEC did state in her budget speech that 1,161 nurses were approved. But the health facilities in the Free State are still brutally understaffed. And I say brutally because the existing staff, due to their workload, suffer from insomnia, sleep disorders, depression, and anxiety attacks. They are frustrated, to say the least. And then the Honourable MEC went on and confirmed that the 26% vacant positions are now frozen. So no relief for the already overworked staff in the near future. In the MEC of Health's 2021 budget vote debate, she spoke of the health workers, and I quote, "This is the battalion of our soldiers at the front line of the battlefield who have spent sleepless nights in the fight against the virus and protected fellow citizens of the Free State. They sacrificed their lives and those of their families." Yes, indeed, Madam Speaker. They have sacrificed, and they still do. Now, why? Why would the department neglect to pay this vital staff, whom the MEC refers to as our soldiers? I am still inundated with pleas from medical staff, ComServe doctors, sessional doctors, interns, who have to struggle to get their monthly salaries, overtime, rural allowances of travel claims paid out. In spite of my 3 member statements made in the past 2 weeks in this August House, and being told that all effective staff have been paid, Madam Speaker, they have not been paid. I've sent a list of unpaid or short-paid staff to the Premier and the MEC to prove it, and I confirmed at 9 o'clock this morning these vital staff has still not been paid. We have lost doctors in the Free State to other provinces due to this negligence. Madam Speaker, these people are not robots. They also have personal lives to maintain. They have families, and not being able to support them puts unnecessary extra pressure on these already overworked people. I noticed that the Honourable Premier did an unannounced visit to the National Hospital on the 22nd of March. Through you, Madam Speaker, I thank the Premier in her absentia. Now I also wonder, did the Premier see the state this hospital is in? Did she notice how tired the staff are? Did she see the bathrooms which the patients and the staff have to use? Did she see the filth? Did she see that there's no wheelchairs at the hospital? Did she see how patients are assisted by other patients to get to casualties? Was the MEC of Health embarrassed or even concerned? Did the Honourable Premier see that the patients did not have linens on their bed? They have to bring their own linens. After the MEC stated in her 2021 budget vote that the department will procure additional linen to cater for the current COVID-19 demands at the field hospital. As this field hospital was never in use but ready, according to the MEC, where are these linens? There were 936 beds. If the field hospital was ready, as stated by the MEC, the department should be well stocked with linen. Then why are our hospitals in the Free State continually experiencing severe shortage of linen? Earlier this year, health workers at Belanomi Hospital went on strike for over a week due to the unsafe working conditions. And now I learned it got an ideal hospital status. Doesn't make sense. Anyway, and vacant positions not being filled. Belanomi went and locked its gates. Literally, they locked the gates. Patients were left unattended. No medication were handed out. Emergency cases were turned away. The gates were locked. Belanomi locked its gates. And as a member of the health portfolio, absolutely no communication came to me regarding this dire situation. Our people's lives were and still are at stake. At 2 portfolio meetings, I've requested contact numbers of officials at the Department of Health in case of emergencies. Needless to say, this request was not granted, even after the department committed, as they normally do. I again want to thank the Honourable Premier in her absentia, through you, Madam Speaker, for always be willing and able to assist. I will never forget the weekend when a dying woman was in desperate need of medical care. But the acting head of department had been arrested and was not available. The MEC of Health would not answer her phone, and out of desperation, I called the Premier, who acted instantly. Thank you in her absentia again. The shortcomings and failures of the Department of Health are indicated in the annual report. The department once again obtained a qualified opinion. According to the Auditor General, the financial statements submitted for auditing were not prepared in accordance with the prescribed financial reporting framework as required by the PFMA. Material misstatements of disclosure items identified by the auditors in the submitted financial statements were corrected, but the uncorrected material statements resulted in the financial statements receiving a qualified opinion. The Auditor General also reported that the department incorrectly removed irregular expenditure from the notes to the financial statements without following due processes. This resulted in the irregular expenditure being understated by 1.1 billion. The department also did not include all instances of irregular expenditure incurred in the notes to the financial restatements as required. This was due to payments made in contravention of the supply chain management requirements, which were not disclosed. The Auditor General reported that he was unable to determine the full extent of the understatement of the irregular expenditure balance stated at 3.3 billion. The Auditor General also found that effective and appropriate steps were not taken to prevent unauthorized expenditure as required by the PFMA. Payments were not made within 30 days or within an agreed upon period after receipt of an invoice as required. Now I understand the shortages of consumables and medications. Suppliers simply don't get paid in time. The department had significant accruals and payables not recognized of 509 million and commitments of 567 million. The department also had a bank overdraft of 458 million. The Auditor General stated that these events or conditions indicate that a material uncertainty exists that may cause significant doubt on the department's ability to continue as a going concern. Madam Speaker, to make it clear, the department is bankrupt again. The Auditor General also found that no sufficient appropriate audit evidence could found that disciplinary steps were taken against officials who had incurred irregular expenditure, again as required by the PFMA. This was because investigations were not undertaken into all irregular expenditure. Now I wonder how many more arrests would follow if these steps were taken. Through you, Madam Speaker, this is where the member of the Executive Committee should have stepped in and taken action. Last year's report was just as damning. It's not a new thing. The Auditor General stated that the financial management processes and leadership monitoring thereof were not effective to present unauthorized, irregular and fruitless and wasteful expenditure. For the year under review, management also did not take adequate steps to follow up on the expenditure already identified in previous financial years. Madam Speaker, anybody who says I'm lying about this is saying that the Auditor General is lying. Madam Speaker, 2 years ago I raised several issues at on the Mufamahadi Manapu Mupele Regional Hospital in Putadichaba. Now, 2 years later, the situation at the hospital is as follows: staff shortages, electricity problems, water crisis. Patients have to fetch water from tanks outside. Patients. Lack of security. The MR scanner has been unoperational for the past year. The unstable electricity supply burned out this multi-million rand scanner. In 2 years, nothing has changed. A caring government? Madam Speaker, I must commend the Department for the rollout of the COVID vaccination program. The Free State is indeed the leader in the country with this rollout and has to date vaccinated 58% of its population. Although the fully vaccinated, as per the National Department of Health, is only 37%, this is still higher than other provinces. I want to thank the Department for diligently supplying the daily surveillance report to the Portfolio Committee. I also received the weekly vaccination site program, which I distribute on our networks to encourage people to get vaccinated. Madam Speaker, what makes you so important when you become an MEC? So important not to have to follow the health protocols of this country, even if you are the MEC of Health. I was lost for words when I saw the MEC refusing to be screened for COVID at the State of the Province address. When I approached her, she said it was not necessary as she is vaccinated. She eventually turned back to be screened at my insistence. Bystanders came and thanked me for pointing this out, as this is apparently a regular occurrence. Madam Speaker, Regulation 69(6) of the Disaster Management Act was at that stage. Gatherings at workplace for purposes are allowed, subject to strict adherence to all health protocols. This is the law, as all other laws in our country does not exclude people who think they are important. If money and material things make you believe you are better than others, then you are the poorest person on earth. It is very disturbing to see how members in this August House make fun of the pandemic. May I remind them that lives and livelihoods have been lost as a result of this pandemic. This is no joking or laughing matter. Yes, it has been a difficult 2 years for everyone. But these problems have been ongoing since 2014, since I have started. But Madam Speaker, the pandemic also happened in the Western Cape. And they had the same challenges as every other province in this country. But let's see what they have accomplished to deliver, how to deliver quality healthcare services to their residents in spite of these challenges. The Western Cape was the first province to have a unique patient number across all their patients attending all the public health facilities. Madam Speaker, some of our clinics don't even have electricity, telephone services or filing cabinets. In the Western Cape, 95% of residents are within 5-kilometre radius of healthcare services. In the city of Cape Town, 92% of people are within 10-kilometre radius of a district hospital. The Western Cape is the first province to have its public hospital and primary health care digitised, including 265 primary health care centres, 181 mobile posts, 51 acute and specialised hospitals, 28 intermediate care facilities, 48 EMS stations, 17 FPS laboratories and 2 oral health centres. Now that is how the fourth industrial revolution benefits its people. It's not just talk, it's action. Since 2019, the Western Cape has spent close to 729 million on new healthcare infrastructure and 658 million on existing infrastructure maintenance. Madam Speaker, may I remind you, some of our clinics don't even have running water. To ensure rural access to healthcare in the Western Cape, the HealthNet patient transport system operates at 230 pickup points across the province. Every year, over 105,000 patients are transported to healthcare facilities through this 90 million rand service, which is unique to the Western Cape. The Western Cape Department of Health, now called the Department of Health and Wellness, has increased the number of people receiving monthly medication from this unit to 430,380, with a total number of over 5 million parcels being delivered for 2020-21. The Western Cape Department of Health was the only health department to receive a clean audit. It has now received 3 successive clean audits. A total of 642 new bursaries have been awarded to medical students across various disciplines. Not merely promised, Madam Speaker, they weren't promised bursaries, they received the bursaries. Now that's how the 4th Industrial Revolution is put to use. Madam Speaker, for those who don't know, the vision of the Free State Department is a healthy and long life for the Free State community. The mission is provision of accessible, efficient and quality healthcare services to the Free State community, and the value system entails integrity, accountability, responsiveness, respect, empathy. I've read this over and over and over, but I struggle to see how this can describe our dilapidated health system. The DA salutes the dedicated staff at healthcare institutions who continue to serve the public in these horrendous situations. I leave you with this African proverb, a roaring lion kills no game. I thank you.
Honorable Leko.
Yeah, guys, sit down. Speaker, thank you very much. We agree with the honorable member that she is not lying about the statistics paraded here about the Western Cape. But we think that it is a distortion and betrayal to her oath as a public representative. Because the research about Western Cape is deliberately being presented only as it accounts for people who are living in the town. It does not include people in Kaelisha.
Order. Honorable members. Honorable members. The member is debating. You just debated. Nobody howled at you. Nobody should howl at anyone who is on the podium, even if you do not agree. Nobody in the House has a right to howl at anyone. Is that a point of order?
Hey, Rudile Twenujai Farad.
Okay.
Kill Air in Twiggy
for an honourable member to deliberately lie and mislead this House and members of the public, as honourable member is doing right now.
Honourable Khakha, you are out of order. You are out of order because, one, you are using the language that is unparliamentary in the House, saying the member is lying. Two, you cannot stand and say when a member is debating, he is lying and misleading the House. Because no member here has ever been able to present any facts and say this is factual. So when a member is debating on the podium, allow the member to debate like everybody else in the House is debating. You do not have that privilege of telling a member that when they are debating to say they are lying. Proceed, Honorable Member.
We are subjected to a myriad of statistics bombarded every day about the Western Cape, which we have never taken an issue whether or not they are tested. And that's why the point we're making is that we agree with her. Maybe she's correct. But we know that statistics have got nothing to do with the Africans and blacks in the province of the Western Cape. These statistics are only being made in town where their constituency, by the way. So they are not a public representative in a true sense of our work seated in this particular house. And it's important that our people should know that. And that's the point we're making. We're not fighting. The ANC is insulted every day to be corrupt and all of that, and we tolerate those things because it is their right to say some of these things which are unscientific, untested, which are inflamed political statement intended to mobilize people.
Pause, please pause. Honorable Khakha, I'm going to say this for the last time. And I'm going to, if you cannot do what I'm requesting you to do, I'm going to ask you to leave the House. I am saying stop making comments. In terms of the rules, it's not allowed. It applies to everybody in the House, but you keep doing it. Stop making comments when the member is debating in the House. Proceed, Honorable Member.
So when we...
What is your point of order, Honorable Member?
Honorable Speaker, again, I wouldn't have a problem with you telling me what you were telling me if you were doing the same thing to Honorable Karata, who's forever out of the House. So,
Honorable Kabat, order. Honorable members, order. Honorable Khakha, in terms of these rules, I, the presiding officer, will make a ruling. And in terms of 103, a point of order refers to the members in the House, not to the Speaker. I called you because your voice was the one that was outstanding. I called out your name because your voice was the one that was outstanding, that I could hear. And I said it to all of you to say, stop making comments while the member is on the podium. Why is it difficult to do that? Honorable Jangerson.
Thank you, Honorable Speaker. We've just seen now in action how you reprimanded Honorable Khakha while the member there was shouting at her from the side, and you decided to reprimand Honorable Khakha instead of her. Honorable Speaker, then I just want to remind you that the Speaker is not above the rules. The rules in fact make provision that if the Speaker misbehaves, this House can, through an immediate motion of no confidence, request that we vote for
the House, yes.
To be removed from this House.
The House, not you.
From the House, yes, the House.
The House.
Order, honorable members. The member is addressing the Speaker.
Don't push us too far so that we have to embarrass you by stopping the proceedings, requesting the Deputy Speaker to take the chair, and for yourself...
You will not succeed.
...remove yourself...
Order, honorable members.
While this House votes on whether you are behaving yourself or
Do it. You're not threatening us.
Honorable Speaker...
Honorable, may I take a seat?
You're not above the rules.
Honorable Jangerson, in terms of the rules, the Speaker is empowered to make the ruling. Go check Rule 1 of your standing rules and orders. In terms of Rule 103, when a point of order is raised, the member called to order shall resume his or her seat and after the point of order has been stated to the presiding officer by a member raising it, the presiding officer shall give his or her ruling or decision thereof either forthwith or subsequently. That Rule 103 does not refer to a point of order. The rule that you are referring to is a different rule altogether, and I cannot stop you from doing that. If you have a feeling that when the speaker tries to put the house in order, calling the members who are misbehaving, and then you will turn it around and say it is the speaker who is misbehaving, then you are welcome to apply that rule. You are more than welcome to apply that rule. Proceed, Honorable Member.
Speaker, the South African transition from apartheid state to a democratic state has been a success. In the past 22 years, we have restored the dignity of all South Africans, not only a small section of the province, everybody in South Africa, including those who oppressed others. We have done so, Speaker, by building democratic institutions, by transforming the public service, extended basic services to everybody. No distortions about statistics, which only apply to a minority in our population. We have stabilized the economy and taken our rightful place in the family of nations. Critical to that, we have enshrined in the Constitution the right to life for all. Not only a particular section, especially the oppressed who were ripped off of their humanness, Speaker. The ANC remain committed to address the inequalities that have also existed before 1994. Health is one of those sectors with some gross inequalities where 87% of our population depends solely on public health system, which has got a meager resources allocation, not only by government. In fact, the point we're making is that it's only government that invests in public health system, and it's doing a wonderful work compared to the private healthcare section, which services only 13%. And this is the section that people are claiming when they talk about the Western Cape. And we're making that particular point. And that's why, Speaker, that the ANC says the introduction of the national health insurance will be our solutions to these problems we're talking about, inequalities in the health sector. To that extent, in 2019, the South African government made a commitment to the United Nations General Assembly that we are moving with speed with regard to the efforts and everything else to ensure that we undertake changes and reforms to achieve a universal health coverage. And universal health coverage is health services to all South Africans, black and white. And this is our commitment. And that's why we will never come here and parade statistics only on the basis of our loyalty to those who only vote for us. We do it even for those who are not voting the ANC. Because when we're elected, we recognize our role, that we're the government of the people, by the people. So this thing is not from anywhere else. Through this work, the ANC affirms its commitment to the ideals contained in the Freedom Charter. A document of 1955 was still loyal, and our work and the speech presented by the MEC today and all MECs is consistent with that, including the assertions of demands, if you remember, in the 1943 Africa Claims, and the document, of course, of the broad and progressive forces, the Road to South African Freedom in 1962, which stated that a preventative health scheme shall be run by the state, free medical care and hospitalization shall be provided for all, with special care for mothers and the children, because this remains a vulnerable area in our society. So it is true that the ANC thinks that the national health insurance is a way to go. We've got milestones that we have achieved in our province, MEC Montentu, that through the conditional grant we have received already,
about 50 GPs have been contracted in about 5 districts in our province, which are ensuring that about 120,000 patients are being able to be seen by these doctors. So it is our contention that South African country desperately needs a health system which will ensure that all people have got access that they need when and where without any financial challenges. So it is as a result of that we welcome the budget speech, MEC2, because it is in line with this historic vision. It is in line with our vision where we want to take our country. You can't, and I think that's where the problem is. You can't have a program or project that is not guided by any policy, Honorable Claude. It's like shooting in the dark. You've got to be guided by that. Don't be afraid to even call it an ideological policy. Because as a country, we have a history. We have a history where a social group has oppressed another social group on the basis of both class, color, and gender. You can't confront such a complex dynamic situation without deriving from what defines you as a political organization, and that is ideology. So clear, the budget speech of the MEC is guided by some of the document which I've made an indication about, the Freedom Charter, and of course how it found its expression in government, the National Developmental Plan, and all of that. So we cannot apportion any money without being guided by those policies. Now, you are somersaulting. The reality remains, you don't support the entirety of all these budget votes, and by implication you are saying, the people who voted for you, let alone others, because you are not responsible for others. We remain responsible and committed that the ANC, upon our election into the state, we will provide services to everybody. You are not. And that's why you are opposing it. And we made this point earlier on, and we are making it now. We hope that those who voted you in power will know these things that we are saying in the House. I even doubt that you are inviting them to these systems. The pandemic, Honorable, did not only expose the Free State government. You are saying it yourself. The pandemic was a national or global, it was a global health emergency. Now, the entirety of the whole world did not plan for it. And that's why history is important to help you to think as a tool. That not long ago, 2007, 2008, the world also was confronted by a financial meltdown. And as a result, there has been a cut of expenditures, including and fundamental, the role of government in the economy through its budget system. Now, COVID arrives over and above those problems. It did not only expose the Free State. Free State province, in fact, in the words of the former minister, Dr. Zweli, said this province has done more than any other to prevent what could have been an explosion as a result of what the MEC spoke about. You remember those people who came here from overseas through a church? That could have been accounted for any other thing unimaginable and uncontrollable. But it is the Department of, but that's not what point we are raising. The people know that. It's not an accident that they've got a number one in terms of vaccination. It is a series of all this good work that the department has been doing. But what COVID has exposed is the legacy of apartheid, of poverty and inequality. You must be told that. Now, you know what they say for those who want to control you. No, dislocate history from your thinking. Do as if this thing never existed, and you will feel good. But the reality will always remind you that history is part of this reality today. And that's what we're dealing with. And that's why we're saying financial meltdown, COVID, exacerbated the South African problem, which is poverty and inequality, which assumed, by the way, the racial posture. And that's why she won't say it, because she disagreed with those statistics. And it's not an office statistics, it's reality that is confronting our country. So we've got to correct you on that particular issue. Not sure the issue of Buhlanya and Nyaupe. I think this, look, debates must be about content and where you can pitch high intellectualism in the interest of the people, to say over and above what the ANC is presenting through its department, through provincial government, we think this is an alternative to help the people. But you come here, you tell us about the budget speed, Buhlanya, Nyaupe. We can't grace that with any intellectual response or engagement. So we must be forgiven that we'll skip this one because there's no alternative provided. Irregular expenditure and unauthorized expenditure. And you see, part of the guests here today are senior officials in provincial government. I'm not sure the extent to which they're embarrassed that ourselves as public representatives, people were elected by the people to lead this province, to not even understand basic concepts. Irregular expenditure and unauthorized expenditure is not corruption. No. It's not corruption.
Nobody must respond to the speaker on the podium.
And that's why subsequent, later, the Auditor General had to be given, his authority had to be augmented to say where you think and suspect that within the irregular and unauthorized expenditure, there are possibilities of corruption. Refer for criminal investigations. It should teach you, it's not corruption. There may be possibilities that is there. And that's why it's still subject to criminal institutions established by this democratic government to establish such. And when somebody is suspected, that person is not guilty. There's a suspicion that, and part of the suspicion includes the accountability, particularly HOD. You did not exercise your authority to act on this, that we said it is corruption or looting or possibilities of corruption and all of that. And that's why any other case, including the case about the HOD of Department of Health, you must understand it in that context. Don't defy the Constitution because you are excited and you want to drive political objectives during debates about service delivery. Elections are coming. Let's wait for that period. So that corruption does not become a password guided by excitement and desperation that you want to find everybody corrupt, even if law enforcement agencies have not ruled on those issues. So it's very important. A corrupt person, honorable member, cannot be a capitalist. I don't know who wrote you that speech, but I think it's done you a disservice. Capitalism is an economic social system which undertakes economic activity and trade for the maximization of profit at the expense of the well-being of the people of that country or that country. Corruption might just be part of the problems. In fact, people are saying capitalism is a problem. It's not many of us. Not sure your organization says that. I hear you speaking it, I hear your rhetoric, and yet the political representatives of capitalism, you are putting them into power in all these metros in Gauteng. Yet you come here and you want to tell us, or I'm opposed to this corruption. No. So you've got to understand that properly. It's not corruption. People who are corrupt are wrong, and the law enforcement, and they must meet the law. But you can't compare them to a socio-economic system that, and the social class and the ruling class is not the same thing. The ruling class are the capitalists. Social class can be any other person, including the working class, which stand opposed to capitalism. So you can't equate them as the same thing. I think this is a dangerous distortion, and the ANC till today is undertaking discussions about, engaging our economic system, including our approach to the economy. The state pharmaceutical company, it's an idea under discussions in the ANC. People must not claim it and fail to locate it properly, because it has got all these things that have got to be attended to. and be engaged. There is something, the point about the regular and authorized expenditures that provincial government and the leadership must do something about it. And there is action. And that's why Provincial Treasury has appointed PwC to investigate irregular expenditure. And
Please, there is a point of order.
Honorable Speaker, again I refer to previous sittings. So in last week, you made a ruling.
On which rule are you standing?
I'm making a point of order.
On which rule? Is that rule 103?
I'm going to tell you now. Hold on, give me a second.
Huh?
Yes, 103 point of order. It's a point of order on the Honorable Member on the table. And the point of order is as this. In conjunction with your previous rulings in the previous sitting.
No. I'm going to stop you right there. Make a point of order in terms of rule 103.
I'm making it in terms of 103, which consistently aligns to 103 point of orders rulings in the previous sittings.
No, I'm not going to allow you to refer to the rulings that I've made.
Okay, then this one is an...
Raise your point of order, Honorable Khakao.
I'm trying to...
And Honorable Khakao, very soon I'm going to apply the rules.
Yes, Speaker, it's fine.
I'm going to do that.
So...
Raise your point of order.
I'm trying to raise my point of order. So on point one, on rule 103, and the point of order is that honourable members on the podium, substantive content and their speeches should be on the debate of the House. What Honourable Mego is waffling about has absolutely nothing to do with the debate.
Withdraw the word you've just used.
I'm responding to you.
Okay, I'll withdraw it. What he's speaking, so what he's saying has absolutely nothing, completely nothing to do with honourable.
What did he say that is not in line with the debate?
I beg that you do not time me because he said a lot, so I'm going to try to repeat everything that he said. So I can't be accused of creating a speech because you asked me to say what he's been saying. So number one, Honourable Meku said that it is absolutely nonsensical for any member of this House to bring in statistics that his office has not tested. That's number one.
I never said that.
Number two, what Honourable Meku stood before this House was to stand and talk about how we are never going to experience any liberation in this province for as long as there's no policies that are directing the content of our delivery, which has nothing to do with the budget again. Number three, I can go on, Honourable Speaker, because there's a list of them. But for the grace of this time and yourself, I am going to say that you refer to Hansard to see what he did say, as you usually do when you do not know when the person said it, so that we can deal with it. I'm saying this because if again we allow this, then none of us can ever be accused for saying things that are not relevant to the debate.
Honourable, that is overruled, that order. Proceed with your debate.
Thank you, Speaker. People are seated in their house and they are not listening, probably playing on their phone. There was an honourable member who joked about the pandemic and COVID and accused some of us in this house, or we are COVID positive. And today she says the leadership of the ANC is making jokes about the pandemics in terms of screening and the MEC. She stood here and said one of the members here is COVID positive and I must leave the house.
Honourable members, do not howl. Do not howl in the house. It's good to raise your hand if there is a point of order you want to raise. But do not respond, do not howl, do not do what members are not doing to you. Proceed.
Madam Speaker, obviously the honourable member at the podium's got
Switch off your mic, honourable member.
Got no idea what's going on in the department or even in this house. I never accused somebody of being COVID positive. So
Was it you?
Don't show your
Honorable
finger at
Member,
me.
please allow her to raise the point of order and I will
I want
rule.
to ask him to apologize for pointing his finger at me, because this is why GBV will never be stopped, because...
Honorable members,
And then
can I request you to be in order?
Then I want him to withdraw. I did not joke and I didn't accuse anybody. But the house on that side sat coughing and putting on masks and laughing if it's a joke. And that was sick, to say the least, Madam Speaker, of the people who have lost their lives and their livelihoods. They are laughing at them. I never said anybody's...
Honorable members.
I showed out. Excuse me, she called me Mrs.
Honorable MEC Kabati, withdraw that comment. No, honorable member, withdraw that comment. Honorable Peter, where you will have to. Okay. What is your point of order so that I can rule?
The chief whip is saying that I accused people of being COVID positive, which I did not do. I pointed out that people did not refuse, even if they were shown back, refused to screen, refused to follow the laws of the country. That's what I pointed out. I never said somebody's COVID positive, and you will find that on my answer. And I want him to withdraw that and apologize to me for showing his finger to me.
Honorable Meku, did you point a finger at her? Let's start there, please. I don't know how you're going to withdraw.
I withdraw the finger, but I can't withdraw a debate.
And then
I can't withdraw a debate.
Can I request to the members in the House, as the speaker sitting here, I know that, and in fact, I don't even want to get to the events of that day. My wish, honorable members, is that we should refrain referring to that. More so that that matter was dealt with in the House and is referred to ethics. Please try by all means to not refer to that incident. I don't want to go back to that and say this was said and this was not said. It's not helping me and it's not helping the House.
Speaker, when we are in a debate, we use our interpretations as a basis to advance our argument. I have nothing to withdraw in saying somebody accused. It's my interpretation of why it was honorable member. I'm happy she said that. Speaker, the issue of the staff shortages is not a straightforward issue. It has got to be handled in a manner that I think the political leadership of the province is doing. Part of the challenges we're raising is that just now during the budget votes, in fact starting from the budget speech, is that the allocations to salaries...
Honorable Khakha, please take a seat. Do you want to leave the House? Do you want to leave the House? I cannot keep saying don't converse, don't make noise in the House. Proceed, Honorable Mayor.
But Speaker, honestly, the House has been made a mockery now. No, the House has been made a mockery.
On who is the point of order? Go ahead and put the motion. On who
No, speak. You call the point of order.
Please leave the House.
You are also pointing it. You are also pointing it. You are also pointing it.
Honorable Khakha, for your conduct, please leave the House because of your conduct.
Yeah. Take instructions from the past.
Please take a seat, Honorable Mayor. She heard the instruction. She had the instruction.
What rule? Point of order?
You go consult your rules if you don't know at what point can the presiding officer request the member to leave the house. Honorable Khakau, leave the house.
I'm trying to pack my things and leave, but it must be registered.
You don't do that, Honorable Khakau.
Everybody must be treated equally.
Honorable Khakau, don't do that. I'll attend to you. I'll attend to you. I'm waiting for the member. Honorable members, order. Honorable Khakau, stop doing that. You are making it difficult to work. You keep doing all these things, contradicting me, making accusations, and I am unable to proceed because of you. Leave the house. Honorable Peter Wayne.
Yes, Madam Speaker. As I understood now, you asked Honorable Khakau to leave the house because she was conversing with her colleague sitting next to her. They were discussing a point. While you were doing that, Honorable Bouwane, Honorable Kubati, and Honorable Wahasa were shouting, leave the house, goodbye, leave. I insist that you ask them to leave as well, please.
Yes.
No, unfortunately, there is no rule that allows you to insist to me that I must do something. In terms of the rules, the members are not supposed to converse loudly. I have requested Honorable Khakau over and over again. And when I try to call her to order, Honorable Khakau talks back at me. Instead of understanding that what she's doing is wrong, and I'll have to stop the member from proceeding and attend to Honorable Khakau. And she did that repeatedly throughout the session. Throughout the session, other members, when I say order, they keep quiet, but she will talk back at me and say, that one is talking and that one is talking. Proceed, Honorable Mayor.
Speaker, the ANC wishes to conclude the debate by saluting the Department of Health under the stewardship of Memonteng, the entirety of the executive, in particular for having taken our province and our people during the most difficult and devastating period ever in the life of humanity, the pandemic after the Spanish flu, and we're almost post the pandemic today. And in as much as we lost those we lost, but we're looking forward with hope that indeed we've got proper leadership in this province. Thank you very much.
The Honorable MEC may now reply.
Thank you, Honorable Speaker. Honorable Speaker, I think most of the issues that really mattered and mattered to be replied to, Honorable Chief Whip did that. And that gives me a pleasure then to continue with my speech, because others, they don't really matter to the communities, because people are here to hear what is it that the department is intending to do. I will not waste time on things that don't really matter, like where the MEC one day refused to screen and all that, because that is not even factual. If I could call those people that were doing the screening that day, they did take my temperature and said to me, MEC, go and sit down, we'll bring the form to you to come and fill it, because that was just what was left. Speaker,
No, but
I think you heard
but
that.
You cannot do
I
that.
think you heard that.
Even if you feel that.
I can answer
Please
back,
pause, Honorable.
but I won't.
Please pause, but I'm not going to allow that. Even if you feel the member is not speaking the truth. One, Honorable Mlelek, even if you feel that the member, what she's saying is not what you know, but you don't allow to do that in terms of these rules that we are applying. So refrain from doing that. Proceed, Honorable Member.
because I respect this house, I won't answer him in here, but outside, I will definitely answer you.
Honorable members, stop talking while the member is on the podium. Honorable MEC Bulwana, stop with the comments. Honorable Muleleki, Honorable Van Vuuren, stop with the comments.
She spoke to me.
Honorable MEC Munsel, you address the speaker, do not address the members directly.
Honorable Speaker, as for the issue of not acknowledging Sasol, we did. I think as we acknowledged people that helped us during the management of COVID and fighting, we did acknowledge that we do have a strategic partner in Sasol, and we cannot even go. In fact, they had been invited to this too, so that we thank them in a proper way. I would just want to say on the issue of the facilities that are to be renovated, Honorable Koloi, the Backen Park clinic, the smaller one, it's not going to be renovated now. We will renovate it indeed as a health post, but however, we want to, we will be moving the place where we had said we would start with it. Instead, start with the Gateway Clinic in Pekolong, because we find that after the clinics have closed at 4 o'clock, we still have a lot of patients that need attending to. That is why we are then going to be opening a Gateway Clinic in Pekolong. The health science, in fact, okay, let me, all irregular expenditure has been disclosed by this department. Nothing has been hidden. And like we said, we did contract the PwC when we still had the contract. Our provincial treasury had still had the contract to investigate. Indeed, it did not investigate all of it, and there are people for this financial year that will be facing the disciplinary processes in as far as the irregular expenditure is concerned. The department did not just sit and do nothing about it. And as for the issue of procuring a helicopter, Honorable Klute, that can't just be done like that. The department can't just say we are now going to be procuring a helicopter, and we are also informed by the money that we would be having. We understand that we spent a lot of money, which really also resulted in over expenditure in EMS because of the two helicopters that we used. But that was not abuse. We actually had to do that to save the lives. But we have seen that we can try and make sure that we do that. We send our specialists down to see the people where they are, so that some of the issues can be addressed nearer to where the people stay, instead of making them fly over to Bloemfontein to get to be assisted. So as the department, we are looking at the possibility of contracting just one helicopter, because we do need it. And remember, it's not just a helicopter, it goes along with the pilot and everything, which is something that it's not readily available. All that we are interested in as the department is to make sure that we save lives. The issue of the pharmaceutical company, I think Honorable Meku addressed it, that the ANC as the governing party is talking about the establishment of the pharmaceutical companies, indeed, ANC is governing at this point in time. EFF is not in government. So for them to establish a pharmaceutical company, they will first have to win the election. They will first have to win the elections, and they are not a governing party at this point.
What you are doing is against Rule 77 of the Standing Rules and Orders, which says no member shall interrupt the member who is speaking on the podium.
Honorable Khatebe, indeed, prevention is the way to go. Prevention is better than cure, and it's less expensive. Speaker, we have successfully implemented the Nelson Mandela Fidel Castro training program, which is based in principle of international solidarity with the people of Cuba. We are immensely proud of the successes of the students, despite many challenges that include language barrier and lack of necessities due to the inhumane blockade imposed by USA on the people of Cuba. of Cuba. At the inception, Free State Province had sent 210 students to Cuba, and we are proud to say a total of 67 of the students are currently doing community service across the province. These are earmarked to be placed in permanent posts on the completion of their ComServe, as we know that we would be then working with the people that will be helping us to implement the primary health care, as we know that the Cuban program of medicine talks mostly on prevention than the hospice-centric one of South Africa. We have 162 students across the country right now that are doing medical internship. Speaker, we had 8 students who pursued their training in China, and 3 of them were supposed to be doing internship right now, but could not, as they face problems of being registered with the Health Professional Council, and they did manage to get that through the litigation. They won the case, and we are at the moment in the process of taking them to our facilities to pursue their internship. The department has a memorandum of agreement with the Free State Province, University of Free State, for 4-year diploma, which will be phased out until 2025. That is the nurses training. And training of 400 healthcare workers on basic life support. As we said that our EMS has lack of this cadre with the qualification of BLS, because we need them to manage our ambulances. Training of 13 professional nurses on the initiation of MDR TB treatment, and reskilling of 200 doctors and nurses on ESMO-E will be going on. On the program 7, which is the healthcare support and laundry services, Speaker, we are truly committed to empower in fact, let me say that the laundry is one of the critical support services in the provision of quality health services, because it helps us to provide linen to our facilities. The linen that was bought for the field hospital indeed was allocated into our different facilities. In this financial year, we'll focus mainly on regular servicing and maintenance of laundry equipment in line with the Occupational Health and Safety Act and manufacturer specifications to improve production and efficiency of laundry services. On the orthotic and prosthetic services, we reduced the backlog of these devices, giving devices to the people with 195,000 patients to 2,662, which translates to a reduction of 48 to 76%. Speaker, health infrastructure that is fit for purpose is also one of our critical programs that we will be working on as the department. And I think Honorable Koloi did mention our vision in as far as which facilities we would be refurbishing and building. Let me conclude my speech by appreciating all the healthcare workers for the good work they continue doing despite the challenges we are facing, and trying to build the department that indeed faced a lot of challenges in the past, even before the advent of COVID. I also want to appreciate the support from my family and their patients, and the unwavering support they give me, even in times when I have to spend time with them and I can't because of the amount of work that I face in this department. I also want to appreciate our Honorable Premier in absentia, the African National Congress, my organization, for entrusting me to lead this department. Let me also thank the HOD and the senior management of the department who assist in making sure that we lead this department and make sure that it delivers on its mandate to the people of Free State. I thank you.
Thank you, honorable members. First, I want to remind honorable members while on the podium, Rule 100 speaks to about the matters that are sub judice, that they might not be part of our debates. I heard some of the members, whilst they were debating, they referred to those matters that we know that they are sub judice. In terms of Rule 100, we are not supposed to do that. I just want to appeal to all of you, honorable members, that this howling and comments and things that we throw at one another, they are making it difficult to conduct the processes in the House. If those things were allowed, honorable members, in the House, we wouldn't be having Rule 76 that says members may not converse aloud. During the debate, no member shall converse aloud or do anything likely to distract the attention of the members from the proceedings. If that was allowed, we wouldn't be having a rule that prohibits that from happening. Rule 77, it says no member not to be interrupted. No member shall interrupt another member who is speaking except to call attention to a point of order or to a question of privilege or to the presence of non-members. That does not necessarily, I don't need that in what I'm trying to address right now. If there is anything that you want to say, you say that by raising your hand. It's either it will be a point of order or it will be a question of privilege. But in terms of the rules, you cannot just burst out and disturb a member who is on the podium and speaking. Because what you are doing, you elicit a response from that member who is debating, and they will respond, and there will be chaos in the House. I don't think our guests sitting here and those that are outside and the people who are watching these proceedings, that is what they want to. See. So I want to appeal you, honorable members, as we are going to deal with the second motion of the day, that can you please be mindful of the fact that we are governed by the rules in the House. We don't just conduct ourselves anyhow we want to, because we think we should do that. Honorable members, before we proceed to Honorable Jangleson.
Thank you, Honorable Speaker. Just a point of order, you mentioned the sub judice rule, and you said members are not allowed to certain cases. I just want to remind you that the sub judice rule does not indicate that you cannot make references to it. What you may not do is to comment on the merits of a specific case, in other words, to preempt what a court might decide. But making reference to say someone is arrested or someone has been charged, there's nothing, that's just stating the facts. As long as we don't decide that someone is guilty before the courts have actually tried them. So we cannot comment on the merits of the case, but we can reference. There's nothing in sub judice that should deal with it.
No, but the rules don't say that. Honorable Jangleson, I will read the rule to you. I will read the rule to you. No member shall refer to any matter on which a judicial decision is pending. The rule ends there. There is no... No, but it's the rules. So, honorable members, I'm going to request that we take a 20 minutes comfort break, and we will come back at 22:01 to continue with the second motion of the day. You want to write your own rules?